we are really excited. Last year we introduced the lavender towels to almost 50 businesses.
Really?
And dozens of them were healthcare organizations and hospitals. Cool. And we were really just kind of doing the introductions kind of at the department level. And so individual departments would order and kind of test them out. And so through that process and all those samples that we sent out last year, we're really excited to know that 2 health systems here in California have ran the towels through their infection control units and have approved the towels for implementation throughout the system. And they explained to me that was a milestone in itself.
Really?
For the to get that approval.
Sure.
Meaning I'm sure they were really scrutinized to make sure that they were safe and in terms of the production and hygiene.
Yeah.
They wouldn't want for bacteria to get on a patient before surgery, for example. So they really, really scrutinize that through their infection control. It's quite a process, it sounds like. And so, the towels have been approved, and one system wants to focus on patient waiting areas, the concierge team, the surgery center. They explain that post-op, the patients will get our lavender towels for calming, for anxiety.
I wonder if I mean to cut you off, I wonder if lavender has an antibacterial type of a quality to it. Does it? Or?
It does.
Does it? Yeah. That's what I was thinking.
It does. Lavender is really interesting. It's part of the mint family. And has antiseptic properties.
Yeah. Okay.
Mood boosting properties.
Really?
And studies have shown that it helps with sleep as well.
Nice.
And so and so it's interesting how I wonder how that works out with the test there and running it through infection control. But at either way, they the other system wants to focus on employee wellness. And so they described on each of their hospital floors, there's like a room for staff. And so they'll be putting in, we have towel warmers that go with the towels. They'll be putting in the towel warmers and then stocking the towels for staff, for the healthcare staff, kind of basically taking care of the caretakers.
Right.
And so we're really excited now to kind of grow in that direction and to provide that value, especially keeping caretakers in mind and everything that they do.
Right.
And how difficult that job is. And, you read about burnout and just the hours that these staff are going through. And so we're definitely excited to kind of support that.
And being around sickness just all the time.
Yeah.
You know, whether you're susceptible to it or if it just brings your mood down.
Yeah, that's a good point.
People are usually bummed out when they're in hospitals. So it'd be a great place for mood altering.
Exactly.
Right.
Yeah.
Nice.